Hi, I'm Dr. Langley, and I work pretty hard. I work really hard to try to take care of my patients and be worth their hard-earned money. I often take their worries and concerns home with me when I shouldn't. I'm available by text and email with their concerns, and I try to get back to them promptly. I have long appointment times. I work in direct primary care or a DPC clinic, which means I don't take insurance, but my patients pay me directly. So I take that extra to heart that I try to make sure that every dollar we spend on a medication or a lab or image, whatever it takes, that it's really worth it and really going to be something that benefits their life, helps them live longer, better, something like that. So when there are companies out there that are taking that hard-earned money without that promise of return, it drives me crazy. So I wanted to talk about that today. So there are medical things out there that aren't worth it. And it's hard to believe, especially when they're fancy or new or cool technology. I mean, obviously they must be worth it, no matter what the cost sometimes, right? I know that there were episodes of House with that whole body MRI being talked about whether that was a good thing or a bad thing to just get a whole body MRI to find out everything that could possibly be wrong with you. So that's a good episode to watch if you want to get into some of the details as well. But for now, I wanted to talk about some common ones. So take the Pap smear, for example. It used to be recommended as a way to screen for cervical cancer in women, and you would start when you were sexually active and then continue throughout your life to have this screening exam every year to check if the cells of the cervix were looking cancerous. But then they noticed that all these young women that were 18-year-olds starting to be sexually active, and they were having abnormal screenings, which would prompt more lengthy Pap smears and maybe even surgical or freezing removal of parts of their cervix to try to prevent cancer. But then they looked at those parts that they removed of the cervix and there wasn't cancer there. So we began to realize as a medical community that young women just have funny looking cervical cells that are confusing, and they don't turn into cancer, and they tend to go away and look more normal as they get older. And we're not helping women live longer by removing chunks of their cervix at a young age. So we changed the recommendations. No one checks the Pap smears on young women anymore. You're supposed to start at age 21. That's usually old enough that the funny looking cells are gone, and we can actually tell whether those cells might be cancerous or if they're completely normal. So no one that I know of is trying to make any money off of that, off of convincing teenagers to get Pap smears for no good reason, just to take their money. But there's definitely companies out there trying to do that for older people, to convince them that they need tests that they don't need. Maybe they don't trust their primary care doctor, so they don't think that they're really thinking of all the things that they might need or doing the best that they can for them. And that breaks my heart. I hope if any of you are my patients that we have a kind of relationship, that you trust me, that I'm doing my research and due diligence and looking into how we can make you live healthier and happier and longer, and that some of those tests out there just aren't worth it. So for example, mammograms is another way we try to screen for things. But younger women's breasts have more calcium in them, are denser and are denser and more fibrous, and so it's hard to see through them and see what's abnormal and what's not. Calcium shows up as bright white on mammograms, and so does those dense fibrous tissue that happens to be present in young breasts. So the calcium can be a sign of cancer, but it's hard to see it through those dense breasts. So that's why they recommend not doing mammograms on young women as a routine thing. We usually start at age 40 or age 50, kind of depending on your family history. Again, something to talk about with your family doctor, with your primary care doctor, about what age is best for you to check. Because as you can imagine, if you're not sure whether this mammogram is white because that's young fibrous breast tissue, or if it's white because there's calcium and so that might be cancer, they're going to err on the side of taking a biopsy. And if you've never had a breast biopsy or the fear of one, it's a really stressful time. It's really scary leading up to that. You're really worried about what this biopsy is going to show, how painful it's going to be, whether it's going to leave a scar, what are going to be the results and the implications for your life. Getting a breast biopsy or a biopsy of any kind is a big deal. And that stress and anxiety in your life is a big deal. So just because a test is available doesn't mean it's a good idea to get it. Colonoscopies are another good example that everyone can recognize. You know, colonoscopies aren't fun to get unless you really need them. No one wants to have a colonoscopy when they don't really need to have it. And so they have those guidelines of what age that you should start getting a colonoscopy. So for most people, age 50 for white people, age 45 for Black people, they found that race makes a difference in incidence of colon cancer, so it's worth it to start younger. But it can be a tough call when it's so expensive and when it's not a comfortable test in the slightest. Definitely there are risks and benefits that you have to weigh. So that's one of the big things you should talk about with your doctor. The benefits that this test could show, as well as the risks. I mean, it could be wrong. As we've learned with the pandemic, there are tests that are wrong, that are false positives. They say that you have something and you don't really, or false negative. They say that you don't have something, but you really do. Another important thing to talk about with your doctor is what you're going to do with the results of a test. I always like to have a plan for the results before I order a test. So if you're not going to change anything about the way you live or medications that you take, whether this test is positive or negative, then what's the point in taking it? What's the point in checking that test? Another example, carotid artery ultrasound. So that's a test that some of these companies that I've seen order. So it's an ultrasound of your neck veins here, neck arteries actually, to see if there's any narrowings in them that might increase your chance of having a stroke. So our big organization that I trust the most, the USSPF, which stands for the United States Preventative Task Force, it's a group of doctors and epidemiologists who are experts in tracking the chances of what kind of diseases travel throughout the population. They make these recommendations from primary care doctors about certain screening tests like carotid artery ultrasounds, about whether they're worth it or not. And what's really great about them is they don't have a horse in the race. They don't look at how much a test costs. That's not something they factor in. So even though it's $1 million test and it's going to break the bank on all the insurance companies, they're not paying attention to that. Even if it's a $1 test and it's easy to do, if it's not worth it, it's not worth it no matter how much it costs. So they go through the data of how often this happens and how much this will impact individual patients' lives, if it's a really serious disease or not a serious disease. And they come up with grades of whether something is recommended, strongly recommended, recommended, or really not recommended at all, or whether we just don't know enough and we need some more data first. So you can always go to the USPSTF website. There we go, USPSTF, and you can type in your genders, your age, as well as a couple other facts about you and see what screening tests you should be having and not having. And it's a really useful website. I really like that one a lot. I use it for my patients a lot. So what do they say about carotid artery ultrasound? Well, they say that they get a lot of false positives. There's a lot of times that the ultrasound is done and they find that it looks narrow, but it's not really narrow. It's not actually going to impact their life. But now you know you have this stenosis, this narrowing in your artery, and you feel like you should do something about that because you got this test done inappropriately. And so you get the surgery, which is a carotid artery revascularization. They go usually through one of the large vessels in your groin, make a big cut in it, go into your artery with these long wires and try to make a bigger area, kind of carve out the inside of those stenotic or narrowed arteries to make them bigger so that you're not at that high risk of stroke. But guess what one of the complications of that procedure is? 2 to 4% of people that have that revascularization procedure have a stroke within 30 days of having it. Well, that doesn't help. There's a lot of false positives, so a lot of those people probably didn't need it in the first place. It's also a disease that hardly anyone has. It's less than 1% of people have strokes that have it, and only 0 to 3% of people in the population, up to 3% of the people in the population have it in the first place. So it's a rare disease with a treatment that's not great, that's actually more kind of likely to cause problems than to, not more likely to cause problems, but it has significant problems. So if you got that test, the carotid artery ultrasound, without having any symptoms, without having any signs of it causing problems, which is something that your primary care doctor is looking for, then why did you get that procedure? If you had a stroke, that would just be devastating. But these companies aren't mentioning that. They say, oh, well, you have a positive test. Go talk about this with your primary care doctor. And then it's on us to explain, you shouldn't have gotten that test in the first place. Even if it was a cheap test, it wasn't worth it to have that information. It's a dangerous test to get in a way. So building that relationship with your primary care doctor, I mean, those companies drive me crazy. Some of the other things they offer is like an AFib screening, which is an EKG. I offer that for free in my office every day. No big deal. An osteoporosis screening, they call it an osteoporosis screening, but it's an ultrasound of your shin bone, which is not how a DEXA scan, which is a true test for osteoporosis, is done. Those tests are done on your femoral head or on your hip, not on your tibia. That's not what people consider the gold standard for checking for osteoporosis, which is an important thing to do, and they're not doing it. They're saying that you're reassured, you're paying this extra money for it, and they're not doing what you think they're doing. They check for the carotid artery disease. They check for peripheral artery disease by checking blood pressure and ultrasound in your lower extremities. I can check that for free. I can check a blood pressure that checks whether your blood flow is going well into your legs. But honestly, you're going to know if you have poor blood flow in your legs. You don't need to check for peripheral artery disease. If you can walk comfortably and not get really crampy leg muscles, you probably don't have peripheral artery disease. If you don't have swelling and poor healing in your feet and lower legs, you probably don't have peripheral artery disease. It's not worth checking for. Or screening for an aortic aneurysm. If you've smoked more than 100 cigarettes in your life, it might be worth checking an ultrasound on your stomach to check if you have thickening or hardening, a ballooning of that big blood vessel that travels through your stomach. But that's only after you've been around for a little while. At least at age 50, depending on which organization you're following, the recommendations are. But they're not mentioning that in these companies, in these screenings. They're not telling you that the 40-year-old doesn't need this test, and checking it is just going to lead to either a false positive or just be a waste of your time. So I really urge you to not go out and seek extra testing on your own. Instead, find a primary care doctor that you trust and talk about it with them. Don't pay out of pocket for these extra tests that aren't actually going to accomplish what we want them to. Thanks for listening to me on my soapbox. If you want to watch more videos, that one might be of interest to you, and please subscribe to our channel so that you can get notifications about when I release a new video. Thanks for watching.